Hello all, this is Monika from CSIR National Chemical Laboratory with my colleagues Tubai Chowdhury and Supriya Ughade, students of Dr. Pankaj Poddar from PMC Division. Welcome to our video on the effect of changes in food and lifestyle on health due to COVID-19 lockdown in India. We will be discussing about the health problems which we may face due to this lockdown. To measure the health problems, we mainly focus on three aspects. First, obesity. Second, BMI, that is body mass index, and third is waist size. Initially, my colleague Tubai will give you some glimpse about all these three aspects, where he will be discussing how obesity, BMI, and waist size play a vital role in calculating individual health risk. Next, we will be discussing about the studies that are being done on different set of population. Further, in our study, to track the lifestyle changes of the individual, we have created a survey comprising of a list of questions capturing the details of the participant activities before and during the lockdown. We have captured the question set including food habits, work lifestyle, physical and mental activities that an individual does before this lockdown and during this lockdown. Further, we have done the analysis based on the data that we have collected from this survey. Come to a conclusion which lifestyle followed by the participant fall under which group of high risk. Now, Dubai will start.
So, what is obesity? In this slide, we want to understand what is the obesity and what is the global situation regarding the obesity. So, obesity is an overweight rising global epidemic problem. It's a non-communicable disease. It creates an enormous socio-economic and public health burden in developing countries. And it's according to WHO, it's an most neglected disease, public health problem which affects the every region of the globe. So basically, overweight is defined as the abnormal or excessive fat accumulation in different parts of body and that impair our health. So more than 2.1 billion people are obese in worldwide. It's the 30% population of world, and India stands at the third. So next situation is what the conditions of India in regarding the obesity conditions. So NFHS is the National Food and Health Survey of 3, and NFHS 4 is National Food and Health Survey 4. The National Food and Health Survey, which is conducted in 2005 to 6, and National Food and Health Survey 4 is conducted in 2015 to 16. So there are 10-year gap. So we are checking that the India has thin population in women is 30% in NFHS 3, and the 13% is the obese women population. But in NFHS 4, the obese population strictly rise on 13% to 21%. In case of men, there are 34% men are thin, and the 34% men are thin, and then 9.1% men are almost obese, and 19% are right now overweight. So it's a almost double increase. If we go one beyond NAVHS 2, there is the condition is 8.4%, which conducted in 1998. It's 8.4%, and again it's come to 13%. So it's almost double increases. How many are obese in India? In case of children, the obesity also is the problem. 3.12% children, female children are obese right now, and 3% male children are obese in India. And in case of adults, more than 20 years, 7.04% are obese in adults, and 4.58% are obese 4.58% are obese in females. So almost 14 million people are obese in India. So it's right now it's alarming conditions for us. So take us look for it in a serious note. Then to prevent it. So in the next slide, we are learning to know. We are trying to establish what are the different causes of the obesity. What are the mainly are the genetics, overeating, hormones, medications, insufficient sleep or oversleeping, sedentary lifestyle, anxiety or depression. These are the images of the protein. These are the protein images of the different hormones which regulates our food, our hunger, food, and this is the leptin hormone which tell us our brain that we eat all the things. The adiponectin hormone something it's somehow help to insulin hormone to secrete or signaling, and the ghrelin hormone which tell us that how we are hungry. So how we feel hungry and how, when we feel we are full. So in case of our brain, the stomach secretes ghrelin hormone and comes to our brain, and our brain tell our brain that you are hungry, you have to take the food. Then we take the food, and after that, after digestion, the incretin hormone are secreted. The incretin hormone stimulate insulin hormone to secrete, and the insulin hormone take the glucose from the blood and it store it in different muscle cells, liver cells, and different cells. After that, adipose cells are secreting leptin hormone, which cross the blood-brain barrier and go to the hypothalamus and tell us that you are enough eat, so you are now full. When in case of we if we have the insufficient sleep or sleepless night, so that we have enough time to eat, and the in this time the ghrelin hormone concentration also high, and the leptin hormone concentration is low. So due to ghrelin hormone concentration is high, we are feel hungry, and due to the leptin hormone concentration low, we take the foods, and due to the sleepless night, we are very much little bit tired, and our activities therefore our activities reduce. So we take the energy dense food. Due to the reduced activity, it's convert into the obesity. So in sedentary lifestyle, what is we are morely in sedentary lifestyle, we are morely what are the energy dense food we are taking, where not energy expenditure or energy intake is not balanced. That's why you're gaining weight. In case of anxiety or depression, there are main three neurotransmitters depends on it, serotonin, dopamine, and phenolphthalein. So this somehow regulate the ghrelin hormone and leptin hormone concentration. Feel us that we are hungry, and that's the main causes of the overweight. And then next slide we are explaining that what are the main causes, what are the main effect of the overweight in our health systems. The mainly effect of the high blood cholesterol, lipid disorders, type 2 diabetes, heart diseases, stroke, high blood pressure, gallbladder disease, osteoarthritis, joint disease, and many more. These are the most effective diseases we are listing. So in the next slide, how we feel that we are obese, we are overweight, we are underweight, we are that the index quotient is BMI, the body mass index. So what is the body mass index? The body mass index is defined as the weight divided by the height square, kg by meter square. It's regarded as the most suitable indicator because it's a very easily we can calculate. So there are some limitations. These limitations are failure to identify where the fat is stored in the body, and two people have the same BMI but have very distinct body shapes depending on the distribution of body fat, and consequently have a distinct risk profile. So because of that, one athlete has some muscle cells and the her fat is stored in muscle, and one some normal people have some same weight, same height, the BMI is same, but the her body fat is stored in abdomen. Uh, That's why using the BMI, we can't say that he is fat or not fat. He is fit or not fit. Sorry, he is fit or not fit. The general population is focused on absolutely body weight rather than focusing where the body weight, where they carry their weight. So according to the BMI categories, the underweight, normal weight, overweight categories is this, and the obesity is this. Then why are you considering what? Why are you telling with the BMI and the waist size? Because if the fat is stored in our abdomen, then there are main three type of diseases are occurred very severely. That's the cardiovascular disease, type 2 diabetes, and metabolic syndrome. So where is the fat stored? It's a very powerful technique. So using the waist and BMI, we are try to understand which people are in moderate risk, which people are in risk, which people are in no risk. If the man's BMI is greater than 40 inches or greater than 90 cm, he and his BMI is normal range or overweight range. Is normal range, he is in increased risk. In overweight range or at risk, it's in moderate risk. According again, if the female's waist size is greater than 34 inches or greater than 18 centimeter, if his BMI is also fall under the obese 1 or obese 2 or overweight range or normal range, he has some increased risk, moderate risk, or severe risk, or very severe risk. So combining these two techniques, we try to understand who are in risks and who are not in the risk. So in the next slide, we want to show that what are the confinement effect, how the confinement and how the COVID situation, the lockdown situation affect our lifestyle and affect the obesity. So on 24th March, Government of India ordered a nationwide lockdown. It's initially for 21 days. So we all know that it's become more than 90 days. We are locked down in home. We are confined in India. More than 1.3 billion population are in home, and the due to cumulative of the COVID-19, the physical effects on those infected and so it's coming the in news are coming the COVID situation, and we are maintaining the social distancing due to to defend the COVID-19 system, but this somehow increase our stress level. So we are budding the depression level, and due to the increases of the days, we are gaining the depression level more and more. So in the next slides, we are represented what are the lockdown effect in our lifestyle. So we are starting the work from home, and what are the lifestyle effect in our daily life. So we are starting work from home. We are our sleeping hour is changes. We are most of time are in home, so we are emotionally little bit depressed, and so most of the time in news we are hearing the COVID news, and these people are dead, these people are affected, these people are in a day that much people are coming. So they are morely bored in the news and bored in our lives. Little bit we are feeling emotionally hungry. It's called food craving somehow. Somehow we are eating some food. We are not physically hungry, but our mind says we are hungry. Getting the food and carbohydrate containing food and sweet containing food is swing our mind. And by the way, swing our mind, the serotonin hormones some secret, and our mood is swing for taking some little bit food or something. But taking this more amount of carbohydrate foods, we're getting some obesity region also. So that there are some effect examples also shown in China. So one boy, his name is Zhao. See, in the next slide, we are representing the what are the new lifestyle effect in China. So one boy called, his name is Zhao. He's 26-year old. He gained his 100 kilogram weight during 5 month lockdown, making him the fattest person in the world. So in the next slide, we are representing some literature review. What are the past works are done regarding these Indian obesity factors, and what are we are want to do. So first one paper is the obesity in India. It depends on the NFHS 3 National Food and Health Survey, and 3 National Food and Health Survey 4. What is the conditions of Indian obesity, and next paper is the what are the socio-economic condition in the obesity of India, and how the women's in urban state, how the women are gaining the weight depends on that. The next third one paper is the ghrelin signaling, how the ghrelin hormone secret and tell our brain to you are hungry, and how the it cycle it understanding that. And the fourth one is the body mass index and the body fat. There is a meet the body mass index and body fat, but these are the two separate things. Body mass index depends on the at height, weight divided by height square, and the body fat is the fat is accumulated divided by the total weight. So in the next articles, the lack of sleep, how the sleep contributes, how the sleep contributes to our daily our life system. And the fourth one is little bit similar with our in the Italian population, how the COVID-19 changes the lifestyle and what are the eating habit changes. So from this, we want to relate some COVID situation, how the effect in obesity. The next part will elaborate it by Supriya ma'am. She elaborated the next.
So, due to this lockdown, hashtag stay at home, a sudden and radical change has occurred in the habits and lifestyles of the population, with a drastic reduction of any form of socialization. This physical distancing and self isolation strongly impacted on the citizen lives, mainly affecting the eating habits and everyday behaviors. And that's why it is necessary to conduct and analyze the survey on changes in the food habits, food frequency and lifestyle of the population in India. And these changes as increase or decrease the energy intake, stress in our daily life, and it's directly connected to the health issues like overweight, obesity, and many others. So considering all these changes, we design and we conduct the survey on the changes in the food frequency and consumption. And after collecting and analyzing the data, we draw some conclusion over the healthy lifestyle and food habits during this lockdown, and also give some tips for the healthy lifestyle. We conducted this survey from 18th of May to 12th of June 2020. So in the next slide, we include the 5 sections of survey questions. So first section involved the personal data of gender, age, weight before and during the lockdown, waist circumference and height. After collecting all the data, we calculated BMI and compare it with the waist circumference, and conclude from the analyze from the data that among the participants, how much percentile of the participants are at no risk or high risk or very high risk. And in population, we consider all the listed occupations. These are some questions we included in the personal data. In the next, we include the food frequency consumptions. So in food frequency consumption, we mainly involve the milk consumption, curd consumption, rice, bread, pasta consumption, vegetables, egg, meat or fish, paneer, cheese, like food, fast food, salt consumption, sweet ingredient, alcohol, soft drink, and smoking consumptions. And next slide, we include the questions we included in our survey. So in that, we in the options we give the all type of options, like if we collect the data of weekly and daily basis. Then after that, in third, we included the food habits questions. So food habits questions mainly involve the breakfast, lunch and dinner in the meal. If they are skipping any type of meal, then what type of meal they are skipping? Will they follow same time for the meal, or they take the different time or irregular manner before and during the lockdown? Again, what content they are taking in the diet or snacks during and before the lockdown, and main which is the water intake every day. So we include the options which we shown in the next slide. So we include the options like in water intake mainly uh, we give the uh, we give the options like 1 to 1.5, 1.5 to 2, and many more. And in snacks, we taking the content diet in we taking the content of carbohydrates, proteins content. And again, snacks we can taking the fruit consumption during the snacks, and all that. So fourth section, we include the lifestyle and physical activity changes. So during the lockdown, it is expected to reduce in the physical activity. So we collect the data of physical activity, working style before and during the lockdown, how they spend their free time before and during the lockdown, resting hours during the lockdown. If they are doing any kind of meditation, then how much time they are doing this meditation. If participants are at any stress level, then what stress level they are before and during the lockdown. We include some questions regarding that. So uh, we conclude we include the options according to the participants daily and weekly basis. Then in next slide, we include the awareness questions. So in awareness questions, we include the awareness about the leading issues of the health. And again, if they are overweight, then what is the reason behind that? And as the government issued the Ayush immunity boosting measures for the self-care during the lockdown, and in that they involve some steps to boost the immunity. So what steps they are followed during this lockdown to boost the immunity? So next slide, we include the options of the steps which issued by the government of India. So in that, they include the drinking of warm water, daily practice of yoga, use of spices, drinking of herbal tea, drinking of golden milk, and chyawanprash. So after collecting all the data and analyzing the data, we conclude the results, and these results further discussed by Monika.
Now we'll discuss the survey results, followed by evaluating them. Among all the participants in the survey, nearly 55% are male and 45% are female. According to the age distribution, the participant age is in between 15 to 60 years, in which majority of them are 22 to 30-year-old. When we talk in terms of occupation, more than half of them are students. There are other professions also like academics, housewives, software and hardware engineers, and many more. Here are the plots of height, weight and weight before and during the lockdown, so that we can determine the changes due to COVID-19 lockdown. We have also took waist, as Tubai has already discussed, to examine the health of the person. Waist is an important factor along with the BMI. These maps represent the area of the participant before and during the this COVID-19 lockdown, as many people moved to their hometown. This shows that the survey data is from different zones of India. Now, after personal information, coming to the food consumption part of the survey. During this lockdown, most of the population declares the change in the food habits. From the survey data, we can see that consumption of milk, tea or coffee, egg, meat, fish, paneer, cheese has decreased, while the consumption of food, fruits, vegetables, curd, rice, chapati has increased. Here also we can see from the survey data that the consumption of alcohol, fast food, sweets, cakes has reduced. However, the consumption of ghee, butter, legumes, pearls has increased. Although the consumption of sweets and cakes has reduced, but the consumption of sweet ingredient in the meal has increased. The consumption of soft drink and smoke has also decreased during this COVID-19 lockdown. After food consumption, we'll talk about food frequency. When we talk about the food frequency, we observe that majority of them eat breakfast regularly and majority of them eat their all-day meal on the same time. Here we can see majority of them change their daily diet on daily basis. Their diet is mainly based on carbohydrate and proteins. When we ask them, if you skip any kind of meal, which meal do you skip? The answer is either they will not skip, they are not skipping any kind of meal, or majority of them will skip the breakfast. Snacks are mainly based on biscuits, breads, which increased during this COVID-19 lockdown, and the consumption of fruit is also increased during this lockdown. However, the consumption of samosa and all has reduced during the lockdown. Majority of them drink water in between the meals. Further, we can see from the bar columns that the consumption of water has increased. People has increased the water intake, which is very good to their health. When we now coming to the physical activity part, majority of participants do physical activities sometimes. The practice time has increased during the lockdown. Next, working style. Before lockdown, people used to have both type of working style, physical and mental. While due to lockdown, majority of them shifted towards the mental work. Mental working hours has increased during the lockdown. Now, when we ask participants that how you spend your free time, majority of them say watching videos, TV, or scrolling the social media networking sites, which increased during this lockdown. Sleeping hours has also increased during the lockdown. Regarding the medication, majority of population said no before the lockdown, while some people started the medication during lockdown. In meditation, majority of them used to do yoga. Practice time of that has also increased during the lockdown. Also, the overall stress has increased. Majority of participants have good lifestyle. I mean, they are their lifestyle make them feel well. Regarding the reason for their overweight, either they are not overweight or the main reason is lifestyle. Now, when we compile all the food consumption data, we can see that on left side, consumption of milk, egg, meat, paneer, sweet, cakes, fast food, alcohol, soft drinks, and smoke has reduced, while the consumption of curd, rice, fruit, and vegetables, ghee, butter, legumes, pulse, salt, sweet ingredient in between the meal, water intake has increased, which shows that people are going towards the healthy food during this lockdown. But they have also reduced the physical activities in daily life. Mental work has increased, although some people have started the yoga, which is good, but for their health. However, due to staying at home, stress level has also increased. Now, when we ask participants regarding the Ayush immunity boosting plan of government, more than half of them said they have no idea about it. But when we ask them regarding the immunity boosting steps, majority of them said uh, yes, like they used to drink warm water, eat spices, drink golden milk, etc. Now, to study the overall impact of this COVID-19 lockdown in India on health, we do the analysis using BMI, body mass index, and waist size to calculate the risk of that person. As Tubai has already discussed that when we talk about the health, we need to consider both BMI as well as waist size, which tell us the overall risk of our health, at which risk stage we are. Okay, now this metric shows uh, the data of the participant. Vertical line shows the BMI, underweight, normal, overweight, or obesity, and horizontal line shows the risk according to the waist. B stands for data before lockdown, D stands for data during the lockdown, M stands for male, and F stands for female. This is the healthiest data among all, normal with no increased risk, which increased during the lockdown. Underweight data has decreased during the lockdown, as well as the normal data with increased risk is also reduced. While the overweight male participants with high risk has increased. The overweight male participants with increased risk has decreased, while the female participant in this category has increased. Participants with obesity having high risk as well as very high risk has reduced in this lockdown. Now, the overall summary of this data is that participants with normal health are increased, but simultaneously the number of overweight people has also increased during this. The reason behind this changes are the change in food and food habit, stress, change in sleep cycle, emotional hunger, change in lifestyle, and reduced physical activities. From this analysis, we concluded that during lockdown, intake of fruit, curd, vegetables has increased in all the groups of participants. Among these participants that lies in the group of normal with no increased risk were having the intake of these items before the lockdown as well, leading them to a healthy lifestyle. While the consumption of sweets, fast food, alcohol, soft drinks has reduced by this group, although very less amount of participants used to consume all these, but during this lockdown they have also reduces the consumption. These participants have increased the water intake as well as physical activities during this lockdown. They used to drink warm water, do yoga, drink herbal tea and golden milk before and during the lockdown. From this analysis, we came out with the conclusion that one should opt for healthy lifestyle would include doing some amount of physical activity, eating healthy food and drink good amount of water as suggested by the health authority. We would like to thank all the participants who have participated in this survey and our mentors who helped us in this process. That's all. Thank you everyone for your patience and time. By this study, we would like to spread some awareness about the healthy lifestyle. We are happy to answer the questions related to the study. Please share your valuable comments and feedbacks. Hope this video helped you analyze the health benefit based on your lifestyle. Thank you very much for your time.